Brain tumors are a serious medical condition, and early detection can greatly improve the prognosis. While many symptoms can be caused by other conditions, certain signs should prompt a consultation with a medical professional. Researchers and medical experts have updated our understanding of brain tumor symptoms, and it's essential to stay informed about what to look out for. This video will delve into the top symptoms associated with brain tumors, what makes them distinct, and when you should seek medical advice. Persistent and severe headaches. Headaches are one of the most common symptoms associated with brain tumors, but they often go unnoticed because headaches are so prevalent in the general population. However, headaches caused by brain tumors tend to have specific characteristics. They often worsen over time and are accompanied by other symptoms like nausea, vomiting, and vision disturbances. Tumor-related headaches are also frequently more intense in the early morning or after lying down for extended periods. This is due to increased pressure inside the skull as the tumor grows. It's important to note that these headaches may not respond well to over-the-counter pain relievers. If you or someone you know experiences these types of headaches consistently, it's essential to seek medical advice promptly. Ignoring persistent headaches could delay the diagnosis of a potentially life-threatening condition. Seizures, a sudden and startling symptom. Seizures are one of the more alarming signs of a brain tumor and should never be overlooked, especially if there is no history of epilepsy. They can vary in intensity and type, ranging from full-body convulsions to more subtle signs like brief episodes of staring, confusion, or uncontrollable movements in a specific part of the body. Some individuals might experience an aura before a seizure, such as a strange smell or feeling. The reason seizures occur is because the tumor disrupts the normal electrical activity in the brain. Even a single seizure in an otherwise healthy individual should be evaluated immediately. In some cases, a seizure is the first and only indication of a tumor's presence. Given the severe implications, seeking medical advice after a seizure can be life-saving, as early detection of brain tumors can lead to more effective treatments. Cognitive and personality changes. One of the less obvious but equally concerning symptoms of a brain tumor involves changes in cognitive abilities and personality. These changes can be subtle at first, like forgetting things more often or feeling unusually irritable. Over time, however, they may become more pronounced. Tumors that affect the frontal lobe, for example, can cause significant mood swings, apathy, and issues with decision-making. These changes are often gradual, making it easy to dismiss them as stress or age-related. However, if you or a loved one begins to show uncharacteristic emotional or cognitive shifts, it's important to consult a doctor. In some cases, people might even notice that they are less able to perform at work or school due to these mental changes. Catching such symptoms early can lead to timely intervention, which may slow the progression of the tumor. Weakness in limbs or clumsiness. The loss of coordination or sudden weakness in the limbs can be another telling symptom of a brain tumor. This occurs because tumors located in the motor cortex or brainstem can interfere with the brain's ability to control movement. You may notice that simple tasks, such as holding objects or walking, become more difficult. Some people report feeling off balance or even tripping over their own feet more frequently. This can be particularly worrisome if the weakness or clumsiness occurs on one side of the body. As the tumor grows, these symptoms are likely to worsen, potentially leading to paralysis or more severe motor impairments. It is crucial to note that this symptom often doesn't appear in isolation. So if it occurs along with headaches or cognitive issues, it's a strong indication that something serious may be wrong. Vision and hearing changes. Vision and hearing changes are often early warning signs of a tumor affecting the optic or auditory nerves. Tumors that develop in or near the occipital lobe or temporal lobe of the brain can cause a variety of vision issues, including blurry vision, double vision, or even temporary blindness. Some individuals also experience unexplained changes in hearing, such as ringing in the ears, tinnitus, or sudden hearing loss. These symptoms can often be mistaken for more common conditions like migraines or aging, but if they persist or worsen, it's essential to get a thorough neurological evaluation. The brain's ability to interpret visual and auditory information can be significantly impacted by tumors, leading to issues that may interfere with daily life. Speech difficulties. Speech problems can be one of the more frustrating symptoms of a brain tumor. If a tumor is located in the areas of the brain responsible for language, such as Broca's or Wernicke's areas, individuals may struggle to find words, speak clearly, or understand what others are saying. These speech difficulties can vary in severity. In some cases, people may simply stumble over their words or take longer to recall specific vocabulary. In more severe cases, individuals may find themselves completely unable to communicate verbally. These speech issues often appear alongside other neurological symptoms and can worsen as the tumor grows, making it harder to function in social and professional settings. Nausea and vomiting. Nausea and vomiting are common but often overlooked symptoms of brain tumors. These symptoms occur due to increased intracranial pressure, especially as the tumor grows and takes up more space within the skull. While nausea and vomiting can be caused by many conditions, what sets tumor-related nausea apart is that it often occurs in conjunction with other neurological symptoms, such as headaches or visual disturbances. It's also persistent and doesn't seem to improve with typical treatments for nausea, like over-the-counter medications. If you experience unexplained nausea that doesn't resolve within a few days, it's worth seeking medical advice, especially if it coincides with other warning signs. Fatigue and drowsiness. Feeling persistently tired, even after a full night's sleep, is another symptom of a brain tumor that often goes unnoticed. This can be due to the tumor interfering with normal brain function, or as a result of the body using more energy to cope with the tumor's presence. Fatigue in this case is not the type that can be easily remedied by rest. It often comes with other symptoms like cognitive impairment, dizziness, or mood changes. People may also feel drowsy during the day or have trouble staying awake, even in situations that normally wouldn't cause sleepiness. Chronic fatigue is a debilitating symptom that can significantly reduce the quality of life, and if it persists, a medical consultation is crucial. Unexplained weight loss. Unintended weight loss can be a sign of many medical conditions, including cancer. In the case of brain tumors, weight loss may occur due to metabolic changes caused by the tumor, or simply because the body is working harder to maintain normal function. This symptom is often seen in conjunction with other more specific signs like headaches, seizures, or nausea, making it easier to identify as part of a larger problem. If you notice a significant drop in weight without any changes to your diet or exercise habits, it's important to consider a full medical evaluation to rule out serious conditions like a brain tumor. Changes in smell or taste. One of the more unusual but significant symptoms of a brain tumor is a change in the sense of smell or taste. This can happen when a tumor presses on areas of the brain responsible for sensory perception. While it might seem like a minor inconvenience, the loss of smell or taste can have a considerable impact on quality of life. Some individuals report that familiar foods begin to taste strange or that they can no longer detect certain scents. If these sensory changes are accompanied by other neurological symptoms like headaches or seizures, it's a sign that something more serious could be happening within the brain. Thanks for sticking around and learning about the important symptoms of brain tumors. If you found this video helpful, make sure to hit that like button to show your support. And don't forget to subscribe to our channel for more informative content. See you in the next video.